Good evening. We thank you for joining us tonight. We're going to have a presentation this evening on the funds available through the American Rescue Plan for coronavirus relief. As part of our presentation tonight, City Manager Patrick Urich will be going through the allotment of funds, what the funds can and can't be used for, and a way that we can get your opinion on how we should spend the money. One of the things that our City Council wanted to make sure the public was aware of was not only the amount of funding, but in the ways that we could spend it. And your voice is very important in this process. So we'll make sure that you understand exactly how to access that survey so you can tell us what you think. And without further ado, I'd like to present the City Manager, Patrick Urich.
Thank you, Stacy. Good evening, everyone. And thank you for being here to listen to how we can utilize the Fiscal Recovery Funds from the federal government to help Peoria recover from COVID-19. So let's jump right in. As we move, the American Rescue Plan was a $1.9 trillion bill that was signed by President Biden earlier this year. It provided for $350 billion for states, local governments, and tribes and territories. Of the local governments, counties received $65.1 billion. Cities over $50,000 or 50,000 population received $45.57 billion. And then smaller communities received $19.53 billion. In the state of Illinois, there's nearly $13.23 billion coming to the state and local governments. We're seeing in Peoria County, $34.8 million will be coming to the county, and the city of Peoria will be receiving just slightly more than $47 million. There are a number of other areas of funding opportunities in the American Rescue Plan. There's almost $47.8 billion for COVID-19 testing, contact tracing, and mitigation activities, $122.7 billion for elementary and secondary school emergency relief funds. So our schools and our communities will be receiving funding as well. There's $26.1 billion for urbanized area formula grants to aid our transit services in urbanized areas. So that'll help the Greater Peoria Mass Transit District. There's $8 billion across the United States for airports. So that some of that money will roll down to our airport here in Peoria. There's $10 billion for our coronavirus capital project funds for states to carry out support work, education, and health monitoring during COVID-19. The bill also provides $7.25 billion for the Paycheck Protection Program. Those are forgivable loans that were given to small businesses throughout the country. $15 billion will be targeted for economic injury disaster loans, advance payments of $25 billion for restaurants, bars, and other eligible providers of food and drink. So there's, again, more small business support that's built into this law. $1.25 billion for shuttered venue operators like the Civic Center have been included in the bill as well. There's also money for homeowners. There's $27.4 billion of emergency rental assistance, including $9.96 billion for a homeowners assistance fund and $5 billion to assist people who are homeless. There's $7.2 billion in an emergency connectivity fund to reimburse schools and libraries for their broadband internet access and connected devices. There's $50 billion for additional disaster relief efforts. There's $300 million for assistance to firefighter grants and $175 million to create a community navigator pilot program to help people navigate through how they might be able to access these funds. So the money that comes to the city of Peoria has specific uses. And the funding objectives that were laid out by Congress are listed here on this slide. The first is that we're to support the urgent COVID-19 response efforts to continue to decrease the spread of the virus and to bring the pandemic under control. Second, to replace lost public sector revenue, to strengthen support for vital public services, and to help retain jobs. Third, to support the immediate economic stabilization for households and businesses. Fourth, to address the systemic public health and economic challenges that have contributed to the unequal impact of the pandemic. So there are eligible uses for the state and local fiscal recovery funds. The first is that we could support the public health response. The second, that we could address the negative economic impacts that we're facing because of COVID-19. The third is that we could replace the public sector revenue loss. The fourth is that we could provide premium pay for essential workers. And that fifth is that we could provide funding for water and sewer infrastructure. Or sixth, that we could provide money for broadband infrastructure. What does it mean to use it for supporting the public health response? Well, what Congress identified is that this funding could be used for things such as services to contain and mitigate the spread of COVID-19, including vaccination, medical expense testing, contact tracing, quarantine costs, capacity enhancements, and many related healthcare activities. It could be behavioral healthcare services, including mental health or substance misuse treatment, crisis intervention, and related services. It could be payroll and covered benefits for public health, healthcare, human services, and public safety staff to the extent that they work on COVID-19 response. Under the category of addressing the negative economic impacts, it could be used for delivering assistance to workers and families, including support for unemployed workers, aid to households, and survivors' benefits for families of COVID-19 victims. It could be support for small businesses with loans, grants, in-kind assistance, and counseling programs. It could speed the recovery of impacted industries, including tourism, travel, and the hospitality sectors. It could be used to rebuild public sector capacity by rehiring staff, replenishing state unemployment insurance funds, and implementing economic relief programs. Under the third category of replacing public sector revenue loss, it can be used to ensure the continuity of vital government services by filling budget shortfalls. Revenue loss is calculated in this way by being relative to a counterfactual trend, beginning with the last full fiscal year of the pre-pandemic and then growing at 4.1% per year. Recipients may recalculate revenue loss every year during the program, supporting those entities that experience revenue loss with a lag. Under the premium pay for essential workers category, it allows us to provide premium pay to essential workers, both directly and indirectly through grants to third-party employers. It allows us to prioritize to low and moderate workers, those who face the greatest mismatch between employment-related health risks and compensation. The key sectors here include healthcare, grocery and food services, education, childcare, sanitation, and transit. This is one area where the funding can be additive. It can be added to the workers' wages, and it can also be retroactive. So this can look back to the costs that have been impacted from 2020. Everything else has to be proactive or prospectively looking forward as we look ahead. When it comes to infrastructure spending, under water and sewer infrastructure, this means including infrastructure improvements such as buildings or upgrading facilities and transmission, distribution, and storage systems for water and sewer infrastructure. The eligible uses can be aligned to the Environmental Protection Agency product categories for clean water revolving loan funds and drinking water state revolving loan funds. The broadband infrastructure is to focus on households and businesses without access to broadband and those with connections that do not provide minimally acceptable standards. The goal is to fund projects that deliver reliable service with a minimum of 100 megabytes per second download and 100 megabytes per second upload speeds, unless that's impractical. The intent of this is to complement broadband investments that are made through the state's Capital Projects Fund. In addition, the law provided for equity-focused services. And the focus here was that we would provide additional flexibility for the hardest hit communities and families to address health disparities, invest in housing, address educational disparities, and to promote healthy childhood environments. And this is broadly applicable to the qualified census tracts, and I'll talk about that in just a second. And these tracts are areas where we have seen the disproportionate impact. And we'll take a look at that right now. These are the qualified census tracts inside the city of Peoria, where we've seen the disproportionate impact due to COVID-19. As you can see inside the city, it is really the area of the city from McClure Avenue South are the 16 census tracts that qualify as qualified census tracts. So what does that mean within this area of the city? Number one, to address health disparities, it could mean providing additional community health workers and public health benefits navigators. It could be additional funding for lead paint remediation or funding to be used for community violence intervention programs. For housing in neighborhoods, it could be more funding for persons experiencing homelessness, for affordable housing development, and for housing vouchers, residential counseling, and navigation assistance. To address educational disparities, the funds could be used for new and expanded early learning services, for expanded resources for high-profile school districts, and for tutoring and after-school programs. Under promoting healthy childhood environments, it can be used for new and expanded high-quality healthcare, for home visiting programs for families with young children, or services for child welfare families. And this is just examples of the funding. We could be tailoring programs to our own needs as well. What can't we use the dollars for? We cannot use the funds that would reduce the net tax revenue, so we cannot use this to reduce taxes. We cannot use the funds to make extraordinary payments into pension funds under this. So we cannot use it to make additional payments to cover unfunded pension liabilities. We can't use the funds for rainy day funds or to make financial reserve deposits. And we can't use the funds to fund debt service payments, legal settlements, or judgments. So now we get to the point where we talk about where we want your input. Here we have our page, www.peoriagov.org/engage-peoria/. And here you'll see that we have the Coronavirus Recovery Funds survey. And if you click on the Here button on this tab and on this page, it will take you to our citizen survey. At the citizen survey, you'll be able to give us your input into how we should be spending the $47 million. The City Council voted in June to use $10.3 million of the Fiscal Recovery Funds to eliminate our need to issue bonds and to curtail furloughs for non-union employees. So we have $36.788 million that remains to be obligated by the year 2024. So here's where we want you to tell us how we think we should spend these dollars. The first point in the survey is we ask that you to acknowledge the terms of service, that this information that you're going to share with us is voluntary. It will really only take 5 minutes to complete the survey, and that the survey pertains to the community needs that have developed because of COVID-19. We are going to consolidate the information from the survey and present it to the City Council and city staff. And by signing the exempt button, the yes button here, you're consenting that you've read this information, you agree to participate, you're over the age of 18, and that you're a Peoria resident. And then if you have any questions, you can email us at engagepeoria@peoriagov.org. After that, the survey will take you to the community needs page. This is very simple. This is a ranked criteria of need based upon 6 different areas, whether it's business support, infrastructure support, neighborhood revitalization, equity-focused services, operations, or premium pay for essential workers. And here you'll have the ability to rank these in order by 1 through 6, or you can move by grabbing the bar on the left, you can move them up or down to show your priorities. Once you click OK, it will take you to the next page. And the next question is simply to allow you to describe the biggest issue that the city is facing due to COVID-19. This is an open-ended question that you'll be able to put in any concerns about a program or a project or an issue you'd like to see the city face. Finally, if you'd like to give us your contact information, your name, the company that you're with, your email address or phone number, there's an opportunity to do that within the survey. And that's it. you'll be done. After that, the survey is complete. And from here, the next steps are, we're going to review the community input and prioritize your ideas and suggestions into issues. Once that is complete, city departments will be submitting proposed programs to address the COVID-19 related issues. Those projects and programs will be proposed for funding to the City Council. And our plan would be that at the August 24th City Council meeting, we will present the suggestions and issues that have come from the public's input to the City Council, and that at a future policy session of the City Council at the end of August, we will prioritize the spending and make some suggestions that will be tied into the city's budget process. And so lastly, the council will be making those decisions based upon the community priorities, and the selected projects and programs will be implemented by the city departments as part of the budget process. Finally, as we know that this is a 4-year program, we have 4 years to spend this money, that we will be meeting at periodic points where we'll be asking you and the public for additional feedback and input into how we should be spending these dollars. So these are the next steps. And with that, I want to thank you for your time. I hope you fill out the survey, and we look forward to hearing from you so that we can make decisions on how best to spend these fiscal recovery funds. Thank you.